And we are almost live. Hang on one second while I hit two more buttons. There we go. Maybe not. All right, maybe not. Okay, well, that one's just not going to go. We're just going to ignore that one completely then. Remove. There we go. And I will, don't time for that. There we go. Sorry. Okay, good. And we made it live. Hello, everybody. Welcome to the Caring Caregiver Show. I'm your host, Savy and the founder of Gimme a Break, which, of course, is an all-volunteer nonprofit organization that's caring for caregivers. And we're here to bring back the joy of caregiving. That's right. Caregiving used to be a joy, and then it became a burden. And then it just became all kinds of crazy, didn't it? So we're going to bring all that back. We're going to normalize caregiving, and we're going to change the whole landscape to one of joy and knowledge and resources. And that's what we're here to do. We're here to provide you with those resources and help caregivers to survive. You can check out our website at gab808.org. That's where we are. Or you can contact us at info@gab808.org. So just remember, GAB is Gimme a Break. There you go. Easy to remember, Gimme a Break, or gab808.org. And that way we can help you get connected to resources, not just through the show, but firsthand. So go on to that website, go onto our website and fill out a caregiver request form, because that gives us information on what maybe we can do to help research and find you and connect you to the resources that you need of any kind. Maybe you just need to get connected to other caregivers. Well, that's one break we can give you every week. And so every week in our support sessions, and they are online, free, so super easy, super convenient, right there for you at 8 p.m. every Tuesday evening. Just join us. We're just a bunch of caregivers just like you. And no professionals there, no psychologists, nobody's trying to get in your head. It's just a safe space. It's just a safe space for you. It's a place where you can take a break, right? And you can go online, put your headphones on, go on your phone, Zoom right in. And that Zoom meeting ID is 808-754-3787. Type that into the meeting ID and bang, you're in, and you're right there with a group of caregivers just like you. All right, we keep it very positive and educative. So last night, we're rounding out a series of talks that's based on letting go of caregiver guilt. And last night, we spoke about acceptance and how important that is. And how important it is to prioritize your own wellness, because, you're the most important person in the caregiving equation. Without you, there's no caregiving that's happening. So you're very important to that equation. Without you, if you fall ill or you get sick, who's going to care for the one you love? So super important. Share, learn, and connect with us every Tuesday evening at 8 p.m. All right. The Caring Caregiver Show is being brought to you by Gimme a Break. And of course, Gimme a Break, we're here to connect you with resources. Another resource that you can connect with is our online magazine. The Giver's Guide's online magazine is your caregiver's guide to caregiving. And it's exclusively written for caregivers, by caregivers, with a caregiver's point of view, because our point of view is so different from everybody else's. And unless you're a caregiver, you don't get it. And on the cover is, here's our November cover right here. And on the cover is, of course, our beautiful and wonderful caregiver, the winner of our Caregiver of the Year contest in 2024, Shawnee Kanjura, who cared for her mother and with dementia. And she's actually a dementia doula. And she humbly accepted her Caregiver of the Year award at our gala last year. And the question that's being asked on the cover of this issue is, who will be our 2025 Caregiver of the Year? Right? So I'll talk more about that later in the show. Don't go anywhere. Stay tuned. And for now, you can just get your issue and simply go to our website and go to gab808.org/donate. And your tax-deductible donation of $25 or more gets you a Mahalo gift. And that Mahalo gift will include 12 monthly issues. So you'll be able to get an issue every month. And that will give you connection to resources and a connection to articles written by our caregivers that tell you how to practice self-care in 2 minutes a day, in 10 seconds a day, how to do all these wonderful things to survive your caregiving journey. And of course, it helps not only you, but it helps us do what we do for caregivers. My guests today are going to be wonderful because they're a wonderful resource. And the other thing too is that whenever a guest comes on the show, we do an ad for them the month that they're on the show. So this November, you can get the information about our guest in that issue. And there'll be a full page ad in there about what they do and what they're all about. So, it's all connected. And we're all trying to get you the information you need to survive. Okay, I'm going to take a deep breath now as I take this off the screen. I'd like to take just a personal moment today. And you all know, because you all know me, and that I've been caring for my mother for the past 11 years. So I'd like to dedicate this show to her. She passed this past week, and it really was a long journey. It was really, really hard. And in the beginning, I didn't know what to do, who to talk to, who to turn to. I became isolated. And some of you all know that I was very depressed. I gained weight. I felt like I wanted my life to be over too. But I survived it and started Gimme a Break. And it's changed my life, and it's changed the life of so many caregivers. But I sincerely want to thank all of you for your kind comments and for your hearts. You really did help me to get through the eventuality that I knew was going to happen with my mother. And I'll tell you, I really thought I was ready for it. She was in and out of hospice 5 times. I thought, I got this. But it hit hard. And I wasn't as strong as I thought I'd be. So thank you all so much for your comments and for your strength. And this is what community really is all about, that we're there for each other. So thank you. Of course, my caregiving journey still continues on. As you know, the love of my life is going through cancer, and I have my mother-in-law. However, it never gets easier. It gets to the point where you have those that you know will hold you up. All right. Sorry about that. So let's get on with the show. It's season 16, and this is episode 5. It's also November, and it's a National Family Caregiver Month, but it is also National Gratitude Month. And so I sincerely wanted to share my gratitude to all of you for all that you did. And especially for those who went the extra mile and donated to Gimme a Break. Thank you for your hearts for that. Thank you so much, because this is our passion mission. And we're going to change the world of caregiving with your support, and change everything. We're going to completely change the way caregiving has been, and we're going to take over the world. I just know it. Okay. And with it being National Caregiver Month, we will be sharing caregiver stories throughout the month of caregivers just like you. Sorry, I'm trying to do 10 things at once, but I can because I'm a caregiver. And so with that, I want to talk about something that was super important for me, and that I wish I had known and contacted these wonderful people when I was going through all of this, not just with my mother, but I'm glad I can now do something for myself. Because as you know, 50% of caregivers will pass before the one they're caring for. And I talked to you all about your care receiving plan. Well, what about your end of life plan? Do you have that? Do you know what's going to happen with your end of life plan? Are you going to be able to do this on your own terms? And that's why my next guests are here, to answer some of those questions and to talk about what we have not been talking about, but we need to talk about. So please welcome my guests today, Susan, Amina, and Caryn Ireland. Come here, Caryn. There you are. I got you. Hi, welcome, both of you. They are both with Hawaii End of Life Options, HELO, and MAID, Medical Aid in Dying. And I am so honored to have you both here. And I'm so ready to talk about what we don't talk about. So welcome. Welcome, both of you.
Thank you. Thank you very much.
Okay, so there we go. And let me get that up there. So before we start, I always have to ask everyone to share your caregiving journey. So briefly, I guess we'll start with Susan, if you could share, and then Caryn, if you could share your caregiving journeys.
Mm-hmm. Sure. So I guess twofold. On a personal level, I'm actually a caregiver for my husband, who had a stroke 17 years ago.
Wow.
Is quite disabled. So I am a caregiver, as well as all of you. And then professionally working with caregivers, primarily family members with medical aid in dying, which we'll talk more about.
Yeah.
So kind of been on two ends of it. Certainly know the stressors involved in being a caregiver and the importance of having, all the support and information that you need to get through that journey.
Yes, thank you for that. And Caryn, how about you? What's your caregiving journey?
I have a couple of components that really, I think, have helped me as I've started to work more and more with end-of-life care. As a kid in a small town in Wisconsin, I started working in a nursing home as a nurse's aide. And I did that job as all the way through high school, so after work or after school, weekends, holidays, summers, all of that. And I think it was interesting to be in that role at a very young age, because I think that really brought the perspective of the importance of caregiving, as well as the support needed for family members and the patient along the way. And then the other part of caregiving is when my husband was a heart transplant.
Wow.
And it was fascinating to kind of have that situation happen. And he received a new heart, and there was caregiving at that point in time. He lived 20 years. But the caregiving doesn't ever go away, because at the end of life, his heart just wore out. And so it was helping at that end of life perspective. And I think that's part of why being a part of Hawaii End of Life Options, I think sits well with what I feel I can bring forward to the community in the future.
Yeah. And I thank you so much for sharing your stories, and my hearts to both of you, because that is really tough, and it changes the dynamic of everything. And that's a whole nother show, right? Talking about a spouse and having to change the whole dynamic of your relationship and where that goes. Boy, we could talk for hours. But I'll tell you, when it comes to end of life, nobody talks about that. It just sort of happens, doesn't it? And then what? And then, you're the person left with it is sitting there crying and in sorrow. And, I think that end of life should be something we really do plan for, because it should be more of a celebration and not an event that happens when we're not ready for it, right? We can be ready for that. So let's talk about that, because let's talk about what Hawaii End of Life Options is all about, and what medical aid in dying is all about. Let's talk about that.
So I'll start a little bit with just maybe the big picture, and then Susan will probably add all the color commentary. So we're really about a law that was passed in Hawaii in 2018. It actually went into effect in 2019, which is the Our Care, Our Choice Act, Medical Aid in Dying. And what we're realizing is that this act has been in place now for people that have a prognosis of 6 months or less to live. They can still make their decisions. They have to be able to self-administer the medications. But it really is an opportunity for people to start to plan their end of life, rather than kind of having it just happen. And having time to plan it with their family members or their friends, or whatever really fits their model. So Susan, can you talk a little bit more about how medical aid in dying actually works?
Sure. So This law allows you to, if you meet criteria, as Caryn said, you have 6 months or less to live, you're an adult, you're a resident of Hawaii, you've got mental capacity to make this decision. It requires, number one, 2 verbal requests to what we call an attending provider, which can be a physician or an advanced practice nurse, like a nurse practitioner. 2 verbal requests about 5 days apart. It requires that individual is evaluated by 3 different providers. So the attending, someone called the consultant, who can be a physician or a nurse practitioner, who basically verifies that they agree or disagree with the attending, and then a mental health provider, just to assure that they've got mental capacity. And that mental health provider can be a psychiatrist, a psychologist, a licensed clinical social worker, a family marriage therapist. So it can be done fairly quickly depending upon the organization that your attending is involved with. Or it can be kind of delayed depending upon what kind of barriers that you hit. Hawaii End of Life Option really tries to make sure that the process is timely and smooth for patients. And if there's any barriers, such that you're having trouble finding an attending that's willing to participate. So by law, the attending provider does not have to participate. They can choose not to. And then sometimes that leaves the caregiver and the patient like, oh my gosh, what do I do next? So for example, right, we could be contacted and help identify people in the state that are willing to help you.
That's important. That's super important. Yeah. And I'm going to just kind of harp on a point there that you made, but the mental capacity statement is super important. And this is why, one of the things it's part of our strategic plan for this year and continuing on for next year with even more fervor, is our care receiving plan. And my mother would have never, this is a name brand Asian woman who never left the house without a single hair in place, and who voiced very clearly that she never wanted to be lying in a bed or in a home or in a hospital. And she was very clear about that she did not want her life to end that way. Mm-hmm. Everything happened so quickly that by the time we could even think about her passing and getting that arranged, her dementia had already escalated to such a point that she could do nothing about it, and neither could I. And yet we are going passively through our lives thinking that, well, I'll take care of that. I'll make sure I do something about that. I'll arrange that. I don't want to go like that. So I'm going to make sure I, contact these wonderful ladies. I'll do that. Yeah, I'll do that next week.
Right. And Savy, that's a key point. And we tell people you really need to have a conversation with your loved one early on.
Yes.
Way upstream, because so many times in the practice that I was involved with, we got referrals too late.
Yep.
There wasn't enough time to actually meet what they really wanted, or there was dementia or cognitive decline so quickly that they never could have the end of life that they wanted.
Right.
And so it's so important that early on there's a discussion about what your wishes are, having advanced care directives in place, looking at all the options. And of course, medical aid dying is only one option, one of many, and it's not for everyone. But what we feel strongly about with Hawaii End of Life Option is everyone is informed of all their options, and you clearly understand them, and then you make your choice.
And I love that because, we spend our whole lives being in control, right? Some of us are control freaks. And as I said, some of us, and myself included, is that some of us are control freaks, and we want things a certain way. And yet with death, we don't control that. And why not? We should. And my mother, I watched her go into a deep depression when she was battling with the fact that she was forgetting and not remembering. And I could see her come in and out of it. She had Lewy body dementia. And I could see her go through these phases of depression because she knew that at this point, she was no longer in control and couldn't do anything about it. And it was horrible to watch a woman who was so strong and so strong-minded slip away. And then to actually be there and see her deteriorate. And, they call it the long goodbye. Well, I think we need to find a way to plan for that better, to not linger, because then the person with dementia no longer suffers. It's the people who are left behind.
Mhm.
And I had to watch my mother, and I say disappear slowly.
Yeah.
And then when I watched her pass, I watched her body fighting it, and her mind was gone. And I'm sorry, it was such a horrible thing to see.
Mhm.
And that's forever going to be my memory of that.
Mm-hmm.
Mhm.
And I think that this show, the timing of this show, could be any more significant, having had her pass just recently.
Yeah.
But I'll tell you, caregivers, you're in control. You're taking charge. That's why you're the caregiver.
Yeah.
Get your plan together for you now, and help, if you can still help the person you're caring for to be in control, then let's get them in control. But at least, at the very minimum, plan for your exit now, because it is our eventuality. We are all going to pass. Will we pass on our terms?
Right. I
Right?
think the other piece that I would add to that is have this conversation with your physician now as well. We end up doing a number of CEU kind of events for the clinical team, because we do know that it's a journey for the physicians as well, for them to participate in medical aid and dying. It's new for them, and it really has been interesting to hear their stories along the way. But to your point, we absolutely want to make sure these conversations are happening with our family members and with our clinical team.
Yes.
Before it's needed. Because if physicians just maybe need education, we can help with that. If they have, can I support this internally? They'll have time for that. Versus kind of being surprised at the last minute, and then it's tough, right?
And then it's too late, right? And and I think we need to normalize these conversations, and I know for years people said, no, you can't talk about death. If you talk about death, you'll die, but no, you're going to die.
Yeah.
So we all are. So let's do it on our terms, right? We need to have these conversations. We need to have them as families. We need to change that. That's another part of that, changing the narrative to our own lives and to care receiving, and we're going to be taken care of. So why would we want to leave the person who cares for us with this new burden now of our own existence, and how that's going to be in our final days when we can still be in charge of that? What if you lose your voice, right? It's right. Important. And that's why I was so excited to have you on today, because this is something we need to talk about. We just do. It just needs to become a normal part of conversation. Let's have lunch, and the drinks are here. Hey, so by the way, what's your end of life plan? Yeah. I don't know, but I think maybe that's being a little, crass, but it's true. We need to be able to have that conversation in that way. It needs to normalize.
Actually, that might be a really good conversation over cocktails.
Right? I agree. Something like a bottle of wine and yes, and be a little looser. I love that.
And I think the other thing we always do, and Susan, please chime in here, is this: we're talking about medical aid and dying as one of many end-of-life options. And so that's really the conversation. Because it does depend on what capabilities that patient has at their end of life. But this is probably the newest one. And the fact that Hawaii is one of 12 states that has this in place, we really want to make sure that we're doing education so that people don't forget that this option's out there. Sorry, Susan, I didn't mean to interrupt you.
No, I just wanted to say, I think that an important point that many patients or caregivers pick up the medication for the patient. Many patients don't take it, but it's palliative in the sense that there's reassurance. If I feel I need it, I have it. And there was a case where I worked with a gentleman who was quite depressed, had a pretty debilitating disease. And he actually became much brighter once he got the medication. He didn't take it for several months after. But the mere fact that his quality of life actually improved a bit, because he had the reassurance that he had something that would help him die in his sleep if that's what he chooses to do. But it was palliative in a sense.
Yeah.
And so you can stop the process at any point. You can pick up the medication, never take it. But it's surprising the number of people who actually, there's comfort in that, in having the medication.
Yeah, I think so. I would believe that if I knew and everyone else knew what was to happen for me, then, and I had that all arranged, I would think that would just ease the whole situation. You know, you can plan, you can relax, you can enjoy, and change everything, you know. And God, I have some of the worst memories, even as a child, of having to go to the hospital and visit someone for the last time. But it wasn't at their terms. They had come to this point where they had gotten so ill and there was much left of them. And we had to see them like that. Well, we can change that, right? We can change everything, you know. And I think that, you know, this isn't a, you know, you're going to do this in your 20s kind of a thing, you know, unless of course you have a very bad illness that you've made this decision. I think the most of us are thinking this is something we're going to do when we come to the end of our ages, of our age at our life. You know, I'm thinking that, you know, in my 80s or 90s, I want to have a plan as a backup. Because if my dementia now takes over, or, you know, or for my other half is the cancer takes over, then we have a backup to not get to this point. And I that's the way I see it. Correct me if I'm wrong.
Right. And, you know, to the credit of the caregiver, many caregivers I work with have said to me, you know, this is not something I necessarily agree with, but I'm here to support my loved one. This is what he or she really wants. And I'm willing to be that patient advocate.
Yes.
And even though it may not be something that they necessarily believe in or would do for themselves, but they're willing to put that aside to say, but this is what he wants or she wants.
Yeah. It's my wishes. And thank you for honoring it. Right. And this is what I wish to do. I wish my end of life to be a celebration, to be able to, you know, stand and embrace all the people that I love and be able to know that I'm telling them goodbye. And it's on my terms. And that's how I visualize the end of my time here, as however everyone sees it. And so, you know, if that's how you feel, if that's the way you want things to be, then by all means, get the information. And Susan and Caryn can definitely give you that information and at least get you going and have a conversation with your physician. Talk to your doctors about it. You know, they rush around a lot and they have your well-being under consideration, but we sometimes need to throw those questions at them. We have to stop them in a visit. We're not just there for our yearly checkup. By the way, can you talk to me about this? And pose that to them so they can sit there, and you'll find they'll probably sit back down and say, well, you know, let's talk about that then. You know, and let's get the ball rolling on things. And so take charge of your own eventuality, I feel, right? It's
and don't give up if that physician, for whatever reason, isn't comfortable with medically aid in dying, isn't comfortable with the process. Don't give up. We will help you find a provider that is.
Yes.
This isn't for everyone, and there's some very strong opinions, right, among people and providers, and that's okay. We respect that. But you know, if that's something you really want, we will help you find a provider that is willing to go through.
It's a journey for the patient, it's a journey for the family, and it's a journey for the provider. Savy, one of the things that we produced, it's a little bit old, maybe about 4 years ago, was a storybook. And what we could do is send that to you electronically if you want to put it up on your website. That includes a couple of patient stories. It includes a physician story of his journey to kind of get to the point of saying, okay, I want to help this patient. So it just might be useful for people to read those stories. Would you agree, Susan? Any other? I was thinking about the storybook. We probably have a couple of other resources we can send you.
Yeah, that would be great, because you're
hearing a wonderful resource.
That would be really helpful, I think.
Yes, that's a wonderful resource, and thank you for sharing that. In fact, I will, if anyone, once I get that, if anyone does want that, just go ahead and send us an email to info@gab808.org, and it'll probably just be a link, correct? It's an online Is that a link that you're sending me or a PDF?
I think I'm sending you a PDF because
Okay.
I don't think I have a link for it any longer.
And that's fine. And send me the PDF, and then we'll make sure to get that to anyone who wants that. So just info@gab808.org, and we will send that information to you. I'm excited to get that. So email me the PDF, and we'll definitely get that distributed. Susan, Caryn, I can't even tell you. I am so happy that you were on today and that you could share this option, because I feel like caregivers do not know that, not only for the ones they're caring for, but for your own self, that you have this option. And I think it's important that we let people know that. So
thank you very much for the opportunity.
Yes.
We're always
anything else that we,
Yep.
yes. And was there anything we missed? Was there anything else you wanted to share?
Just briefly, I would like to, you mentioned hospice, which is what, a wonderful support to the patient, the family. And we strongly encourage, if you're going to go through medical aid in dying, to also be enrolled in hospice. For various reasons. But it's really something we would recommend in tandem. And if you choose not to do medical aid in dying, certainly do hospice. I mean,
yes.
Right. As you know, that support is
I cannot speak enough about hospice, and I don't want to take anything away from what we've been talking about with you both today, but I will tell you that they are absolute angels, and that I don't know what I would have done without them there for my mother, and for me. I would get a call through the middle of the day. We're just calling to see how you're doing. Are you okay? And they're not even taking care of me. They're taking care of my mother. And so I love that. And they're so kind and so wonderful. And I'd love to put a plug in for the ones that help me, but I'll have them on the show instead. And so, and they were just amazing. And so, yes, I agree. 10 million, 1,000%, 1,000,000,000,000%. Yes. Please, by all means, get help from hospice and accept that, because they are wonderful, especially at end of life. Yes.
Yeah.
And palliative care was another one we talked about, because we could go on about that. And there's just an amazing option to choose even earlier on. So
yes,
yeah,
absolutely.
Yeah. And and we talk about all of that. So we do that we talk about all of this in our sessions, and we talk about it at all of our events. And of course, that's part of our care receiving plan as well. Yeah. So thank you for that, and for you both taking the time to be here, and for talking about what we don't talk about, because we needed to. Yes.
Thank you for the opportunity. It was really great working with you.
Yes, it's great. And great to meet you both. Aloha.
Aloha.
And there we go. And so that's Susan, Amina, and Caryn Ireland of HELO, Hawaii End of Life Options, and MAID, MAID, Medical Aid in Dying. And you can contact them at 808-746-8977. One more time, that's 808-746-8977. So those of you listening in on podcast, there's no time limit on anything. If you're hearing this later, by all means, connect with them, call them. And if you're listening not from Hawaii, if you're also somewhere in the world, I know there has to be some way that you can find out in your local area that there's some sort of assistance with that. Just do a Google search or contact them. Contact Susan and Caryn. I'm sure they will be happy to help you find right now the other states in the United States that do offer this. So know that that's out there. It is an option, and it's a wonderful way to be able to have a plan, because we need a plan. We need to plan for the fact that we're all going to need care at one point in time in our life. So your care receiving plan is everything. Getting your ducks in a row is not just a saying. It's an important thing to do. And we'll be doing more of that throughout the year in 2026. And also stay tuned, because we'll be doing some workshops that really are going to help you to get that care receiving plan in motion and make sure that you have everything you need. So Caryn, and again, like I said, 99.9% of all the guests are caregivers themselves, right? They shared their stories with you. And that's why it's so important to share your caregiving story. That's why we do what we do. We want to create awareness that we're out here, that caregivers are here, and we connect through our stories. We create awareness through our stories. So if you want to share your story please enter our Caregiver of the Year contest. And by entering the contest, you create an awareness. Your voice is being heard. And all you need to do, and by the way, entry is extended to the 10th of this month. We have our entries. However, we just feel that it's so important for caregivers to share your story. And so we have extended that to the 10th of this month. You have 5 more days to enter. Just go to gab808.org/CGOY for Caregiver of the Year, CGOY 2025, and share your story. But know that you're using your voice. You're using your voice to let people know that caregivers exist. We're coming out. We're not going to be isolated anymore, right? We need to survive our journey. So get your entry in now and know that you can make a difference. It's what we do, making a big difference. And thank you so much again to both of you, Caryn and Susan, for your hearts and all that you do to care. Yeah. All right. So as a reminder, this show is brought to you by Gimme a Break and Giver's Guides online magazine. So keep those donations coming. You all know that we are not funded. We do not have any funding. We are here thanks to the kindness of all of you. And we've survived now for 5 years, going on to our 6th year in another month. And we're very excited to see everything that we can do to help support caregivers in all the coming years. Well, that wraps this episode. And apologies are extended from my other, I just received a text from my other guest that was supposed to be on today. And Susan, and I'm sorry, this was Nam Collins was supposed to come on today to talk about the red light therapy. I'll try to reschedule her again. She actually had an emergency and wasn't able to make it. So thank you for letting me know, Nam, and I look forward to having you come on again. As for season 16, we continue on next week, and my guest will be Mike Skeel. Yes, it's not Skeely, it's Skeel. And he is with Impact Health Sharing, and he will be here to talk to us. What an exciting show for next week. Don't miss it. We're here to bring you the resources. That's what the Caring Caregiver Show is all about, connecting you to resources and community with your wellness and survival as the goal. So you don't want to miss it. Mark your calendars every Wednesday at 12 noon Hawaii Standard Time. And you can catch us live on 7 platforms simultaneously. And if not, you can always a week later listen to us on podcast. We're on any platform, Stitcher, Google, I don't know. There's a million of them out there. Apple, Spotify, we're on there. The Caring Caregiver Show, just search it. And if you don't want to search it, just go to our website and you can click on, go to jb808.org/CCS for Caring Caregiver Show. And there's a link to just click onto the podcast right there. There's a link to click onto our YouTube right on our website, and you can get connected because that's the bottom line. You need to stay connected. We don't want to get isolated anymore. We're going to hold hands and survive this journey together. All right. So that's our show today. I hope you enjoyed it, and I hope you start planning now. Get that care receiving plan going. In the meantime, remember to breathe. And hoping that you're finding more joy in caregiving every week right here on the Caring Caregiver Show. Thanks for tuning in, and please always be kind to yourself, and especially to those who care. Aloha, everyone.